externally rotate the arm to get more valgus stress, so you can do flexion, abduction, pronation, supination, those three there, and flexion, adduction. So neutral, pronation, and supination. And then extension, straight extension, right? Extension, pronation, extension, supination. Turn the arm into internal rotation to do adduction.
Adduction?
AD, so yeah, I'm taking the arm and pushing it that way.
Internal rotation and adduction.
Towards the floor. So there. All those three movements there. And you want to look at what's it like going from extension, from flexion into extension, and then from extension into flexion. Both of those are really nasty.
Is that like a U shape that you're doing with the hand?
No, so there's a bump. So if I push down towards the floor, there's a point where it just rolls over the bump and drops into extension.
Oh, okay.
Yeah, doesn't feel good. So if the carrying angle is, when people get a stiff elbow, their carrying angle gets greater, right? So they're gonna, the most sensitive test for the elbow usually is adduction, extension adduction. So there's more range with extension abduction. So neutral, there, pronation or supination, and then pronation. Okay, kind of grinds. Doesn't feel very good. And if you want to assess the elbow, you guys went over that stuff in prone where you push on the olecranon radial head. You're okay with that?
Great technique, by the way.
It's helpful, yeah. It's really helpful, yeah. So that's the supine. That's okay. Line your tummy. It's good you guys use lock and quadrant. It's like pretty powerful. And if you want to assess the lock, here, bend your knees. There, put your head in the middle. That's good. The lock and or the quadrant and prone, right? So you can just, just get it up into this position here and have a feel what it's like. Push on the AC joint in different positions, right? So, and the lock.
And if the quadrant is too sensitive, you just put a pillow under.
Yeah. So if they can't be here, then you would do it in supine, or you put a towel underneath it.
Yeah.
Yeah. So. And then you can do the lock quite easily here too. Just put the arm in relative internal rotation. That's a great place to treat lock because they can't get out of the way and hit you.
Is this less aggressive or more aggressive than the supine?
It's just different,
Okay.
right? I mean, I'll bring the arm up sometimes, and I'll even do stuff like, treat that lock, treat it in a different way up through here, just because it gets at the. We try to hunt around for the most stiffest direction. People, and they can't get the arm up. And the great position.
People fight you less in prone.
Yeah,
For some reason.
they can't see it or
Yeah.
something. Who knows, right? So, and then the great thing is you can push on. You can clear the neck in this position. So that would be a good reason why. Same thing while you get them on their tummy to treat their knee or their back. Okay, so hand behind back. Remember, that's a great position to treat people in. So stabilize the scapula for extension, internal rotation, and then adduction, right? All those don't bother, you can wind the whole thing up, sorry. And we had somebody the other day, you guys ever have any end range? I know I went over this test, but do you guys ever use a perb at all?
The what?
So the other day, Tony had this patient. He goes, the guy said he was fine with straightening his knee and all that stuff, and he goes, yeah, I just can't get down on my knees, or I just can't. So anyway, so Tony made him do some sort of squat, and I said, make him squat. So he came down here, and he goes, oh yeah, that hurts just right in here. It went away. So I don't ever work on this unless the extension's like clear. So if you want to get that last little bit of flexion better, or squat better, externally rotate. So passive external rotation, valgus stress. So you push on derotate the femur and take them into this position here. Now it should stretch on any normal knee on the inside of the joint, yeah? But on a stiff joint, you'll get it out here and it just won't even go that far. You can
Just what's that feel like?
Like a
Stretch on the inside. Yeah.
Yeah, it's really great technique to get last in range squat.
And would you do it the
Yeah,
other
felt
way as
that
well?
before.
The other, like where you would,
Direction, yeah. So I do that. I do assess for that. You know, so I'll come from here and I'll come around here and look at this, but it's not as sensitive for some reason. Yeah, I do assess both directions, but
Okay.
clinically that one seems to get to be and it just helps end range squat. Yeah.